From 2020 began, the world has been in a war against COVID-19. But the real question is, who's winning? Welcome to On the Record. I'm your host, Jerome Sawyer. We have watched as nations fight tirelessly to try and get a handle on COVID-19. While many have managed to get a good grip, there are countries still fighting to keep their heads above water. From lockdowns to strict physical distancing measures, from the closing of borders to strict traveling procedures and even more lockdowns, countries have done all they possibly could to try and win this fight. And for us in the Bahamas, to no avail. Tonight on The Record, we tackle COVID-19, the global fight, as we discuss what has worked in other jurisdictions and countries around the world, the latest developments on the virus, and what we can do next. Don't go anywhere. Our conversation begins on the other side of this break. The project really pays itself.
Correct.
They set up
at the conference, more the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
And welcome back. You're watching On the Record. Our topic tonight is COVID-19, the global fight. I'm your host, Jerome Sawyer. Thanks for staying with us. On July 4th, the Bahamas recorded some 104 confirmed cases with 11 deaths, 89 recovered, and only 4 active cases remaining. 1 month later, we have 715 confirmed cases with 16 deaths, only 91 cases recovered, and 608 active cases. My guest tonight is one of the professionals leading the fight against COVID in the Bahamas. He's the Deputy Chief Medical Officer, Dr. Delon Brennen. Dr. Brennen, welcome once again to On the Record. Let's talk about the huge spike in numbers using the month-to-month comparison. What happened? I mean, we started out beginning of July with open borders, just over 100 cases, and now pushing well over 700.
I think when we look back at the epidemiology of what really happened, we had a number of things happen at one time. So our opening of our borders allowed not only, because most people when they think about it are thinking about individuals coming into the Bahamas, but actually what also happened was individuals from the Bahamas were also allowed to leave the country and then return. And so what that did is it allowed citizens who would otherwise not necessarily be restrained to any particular area to go out of country. They then unfortunately engaged in exercise that allowed them to be exposed and get infected, and then they returned to the Bahamas. And what happened is we allowed individuals to return who had traveled for a very short period, less than 72 hours, without the need for testing. When they returned, they were expected to quarantine upon their return. However, we know that many individuals did not comply with that, and they were out in the community. Their exposure led to them being infected. They then went about their own homes. They went about their regular jobs. They went, to their places where they usually socialize, and they were spreading it from there. And unfortunately, things just kind of mushroomed. On top of that, there were other events as well. So people had funerals and weddings and parties. And all of that just ended up with a perfect storm of spread of COVID-19 in our environment.
In hindsight, what could we have done differently for those who would have traveled? There was a 72 hours. If you went for 72 or less, you came home, you didn't need the test. What should we have done differently, or could we have done differently in hindsight?
If I had to choose two things, the two things I would say if we were to go back to July 1st is to mandate that anyone coming into country, whether they were visitor or Bahamian, that they would have to have COVID-19 testing. prior to returning to the country. And in addition to that, the second thing would be that everyone would go into mandatory quarantine. So once they returned, they would then be placed into quarantine. They would all be monitored in the quarantine. And then prior to leaving quarantine, everyone would then be required to have testing done so that you tested them before they came in, you put them in quarantine, and then made sure coming out of quarantine and before being introduced into the wider population, they would have then been tested again. And I think that would have been the safest way for us to do that. But that was a learning lesson.
How much or how many of those 612 thereabout cases can we honestly attribute to Bahamians who would have traveled and come back home and spread the virus as you would have described it? What percentage would you say, and have you been able to concretely say that any of those infections would have come from tourists?
I think when we first did the analysis on this situation, we were able to say that there were approximately 40% of our new cases were people who individually had traveled. And then we were able to link at least another 30 to 40% of the cases in that analysis to contacts of the persons who direct contacts of those who travel. So you're talking about somewhere between 70 and 80% were directly related to either the person who traveled or a contact of someone who traveled. The other 80%, we weren't necessarily able to directly link in the first instance, but it is likely that there's some generation of, traveler, contact of traveler, and then the other people being in contact with one of those contacts once they got infected, and unfortunately being now a victim of COVID-19 as well.
The recent Hurricane Isaias, how did that impact the work of the Ministry of Health? I know on a particular day, numbers were later than usual. I think there was a lot going on. How did the recent hurricane impact the work? And have you seen any increased spike in cases as a result of people moving around prior to or during that storm?
I think we would have to, because the storm wasn't that long ago, we still have a few days before we'll see direct incubation periods because of exposures in preparation for storm and thereafter. So that it was less than a week ago. So it is likely within the next few days to the next week when we'll be able to tell, is there a change in numbers directly related to the hurricane? And we should see it from our southern islands, then progressing to our central islands and then north. So we would see what that pattern developed from there. So we still have a few days before that would happen. But the major effects that we actually noticed while we were going through the hurricane itself is that there was a delay in things being able to move. So even if you're in the same island, samples that were obtained from individuals who had been tested, moving them around the country, getting those results then done, because people then had to go into the lab, process those samples and get them run. So there was some delay in getting all of that movement done. Boats have to come in, planes have to come in from other islands to bring samples. Those were delayed. So unfortunately, during that time period, we did experience a little bit of a delay. Of course, if you throw preparation for a holiday, because it was a holiday weekend as well on top of that, it's, I guess, in lack of a better term, it's kind of the perfect storm for those delays.
As of August 4th, we were placed on a 2-week minimum lockdown by the competent authority in this place, Prime Minister Minnis. He attributed his recommendations, this one and even once prior to this, to expert advice he's getting from health officials. Just how much of an impact do the medical experts like yourself have on decisions like that impact the country against this fight?
I think in particular, when we start having the discussions with the sort of the policymakers as a whole, so whether that's our Minister of Health in particular, and then getting to have discussions with the Prime Minister and the Cabinet as a whole, we get an opportunity to really express what the science supports, what it is that we, as the grouping that is monitoring directly the number of infections that are happening in country. I think our influence is actually fairly strong because we can talk the science, and then we can relate that in particular when we get questions from the tourism sector, from the financial sector, from agriculture, from housing, labor. We're able to influence how those decisions might be affected by the science that goes along with it as well. So I think it's a strong influence on some of these decisions. Does everything go the exact way that health would recommend it going? No, absolutely not, because there are other considerations, as in those industries that I just mentioned. But I think when the final policies are created, a significant amount of that is built off of what the recommendations are from the health sector.
Does the science support this lockdown, and what are you hoping to achieve with this particular lockdown? 2 weeks, Grand Bahamas coming to the end of their 2 weeks, and the rest of the country is just going into theirs. So does the science support this lockdown, and what are you looking to achieve with this particular measure now?
Sure. The lockdowns that we are doing in country are supported by, the observations of what has happened in other countries, but also closer to home, what happened during the course of our very first lockdown period when we had the first wave. We know that from the very beginning, when there were cases, when we first noticed cases in country in mid-March, we then went straight from there into a period of lockdown. And what that helped us to do, if you watch the curve, is we never had more than 6 cases in one day. And that was on April 6th, either April 1st or April 6th, where we noticed that that was the maximum number of cases. So we were able to arrest the height of how high our curve was going to be, because those lockdowns were instituted as soon as we had cases. And it still took about 2 to 3 weeks before we saw a flattening at that point, and then another almost month and a half before it really declined to a point where we were able to steadily say that we had flattened and then bent the curve in a way to minimize cases.
Do you think that this 2 weeks, though, will be adequate?
I think it will allow us to arrest the continued increase in going from, teen number of cases to 20s to now 60s at a time. We see 30, 50, 60 cases in a day now. I think the lockdown will allow us to decrease that number from going to 100, 120, 150 cases in a day, such that we get to flatten it, in that we will now have a chance to say we have a steady number of cases we're getting in a day. And then it will take us weeks after that for us to then see a decline. So it will not stop us from getting cases, no.
One of the questions that was put to me just individually, somebody said, well, in the Grand Bahama case, if they're under this lockdown, why are we continuing to see the numbers spike? So if you could explain that, once we go into lockdown, why are we continuing to see numbers?
Sure. So the lockdown only stops people from being able to now expose new people. But the people who had already been exposed for the at least 7 to 14 days prior to that, those people are still going to develop disease. So during a lockdown period, what you're seeing is people who have been previously exposed and are now developing their disease. So you'll continue to see numbers during that time period. So all you're trying to do is arrest new infections, from new exposures from happening, so that 2 weeks from the end of that, from the start of that lockdown, you're not going to continue to see those infections go from there. But you expect to see infections continue through your first 2 weeks of that lockdown, because those people have been exposed before you even implemented those measures.
Dr. Brennen, we're going to take a quick break and come back and continue our discussion. When we come back, we dig a little deeper to find out what's really happening with the active COVID-19 cases and why they seem not to be recovering. Don't go anywhere. Welcome to On the Record.
Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. Or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
You're watching On the Record. This segment is made possible by Executive Printers. In the space of July 4th to August 4th, we have seen active COVID-19 cases go from 104 to 715, a notable increase of 612. But yet, during the same period, recovered cases have only increased by about 2, moving from 89 to 91. Each day, we anxiously await the COVID-19 Bahamas dashboard from the Ministry of Health as a gauge of just where we're at. Here via Skype is Delon Brennen, Dr. Delon Brennen. He's the Deputy Chief Medical Officer within the Bahamas. Dr. Brennen, thanks for staying with us. I want to get right back into our questions. I want to talk about some of the challenges that the folks of the Ministry of Health may be facing as it relates to contact tracing and testing. In the last segment, you talked about the fact that on some days during the first surge, we had about 6 per day. That was a high. Now we're getting as high as 60. What are the challenges you have with just trying to keep track and get that information and understand what's happening?
Sure. I think what we are seeing now is that when you have this high a number of cases, when you're built originally to see numbers less than 10, maybe to 20 in a day, and then you triple that, quadruple that, the challenge is it is very difficult to be able to ramp up that capacity very quickly when persons are now back doing their regular duties. They have other things that they have to attend to, and you're now starting to pull them again. So for as fast as the numbers were growing, it's very difficult to get that capacity up and running that quickly. And so those delays were just inherent in trying to find the human capital to be able to deliver the service. Now that we have pulled those individuals back in, now that we're starting to get our contact tracing back to the level it had been in the past, where we have, declined or decrease the level of service we're doing from other programs, pull those people in, we've now had many of them trained in using direct data entry. So we'll be able to process not just the cases themselves, but the contact a lot faster. And so we should be able to produce, all of the information that we were able to do in the past in a much more expedient manner to be able to deliver that to the public. But it's not just about delivery of those numbers to the public. Each of those numbers represents people that we have to contact or we have to find on a daily basis, make sure that they're well. If they're not well, we have to get them evaluated. So that's important information to stem the tide of spread in the country as well, because if someone tells us they have been in contact with a case, or no, if the case tells us they've been in contact with people, then we need to get in contact with those individuals as quickly as we can to let them know that they've been exposed, to hopefully modify what they're doing in the community as well, so that if they were to develop into a case, they wouldn't have then exposed a larger number of people, that they would have modified their behavior.
Dr. Brennen, did this seemingly catch us off guard? I mean, we're at 700 cases. In my wildest dream, I never thought we would be at it. But did this catch us off guard, even from a ministry perspective? And, how difficult is it now to keep track of all of these people? I mean, I've heard rumblings about people saying that, they're still not being contacted regularly. But, how hard are we able now to really get a handle on this, considering these numbers that came in so quickly?
I think the numbers caught us all off guard, but it doesn't mean that we can't modify our approach and increase our capacity to do so. So in the first instance, no, none of us, I don't think anyone in the public, I don't think anyone in the health sector would say that we expected that volume of cases as quickly as we did acquire it. And so we as a country were all caught off guard in that situation. However, knowing that once you have a problem that you've encountered, you then figure out, what am I going to do? Because that's what people are going to say. Now that you knew you had the problem, when did you find out? And once you found out, what did you do about it? And this is what we're doing about it. We've built the capacity to be able to do that contact. So I don't think you'll find as many people, even today, saying that they weren't contacted, because we are now tapping into our resources at national security, at labor, in NIB, to be able to say, hey, if there's either someone in your agency and or you have contact information for persons that haven't been provided to us, can you assist us with that contact information. We've been asking the public over and over again, you say you haven't been contacted, but are you answering the phone when the Ministry of Health contacts you? Because we find it as simple as that. People will ignore our calls or block our calls because they don't want to, be harassed by the Ministry of Health. But we need to get in contact with you to let you know that you've been potentially exposed, and we just want to protect you appropriately.
Which brings me now to my next point. The police force has been tasked with monitoring all people in quarantine with the Hubcat system. Is this going to be more effective for you? Do you think people are now going to take it a little bit more seriously because it's being monitored by the police?
I think it'll be the enforcement unit. So they are going to have a whole COVID enforcement unit that'll be, countrywide. That will definitely change the perspective because, it's a lot different when you have a physician or a nurse or, a health administrator calling you up and saying, you need to stay at home. And if you don't, then people are saying, well, if I don't, then so what? And they just ignore it. But if you know that the Royal Bahamas Police Force and national security as a whole is monitoring and are actually going out and showing up at people's homes, if they find out they're not at home, show up on their job to make sure that people are where they're supposed to be. They keep the app on the phone. They make sure the location services are activated. I think it's definitely going to change that. And they'll be a lot more visible. They'll be into business places. They'll be into recreational places. They're going to be more visible physically on the ground, making sure that people do what they're supposed to do, doing those surprise checking.
We've got to move now to this question of the recovery rate. It does not seem, at least from the numbers that we are seeing, that people are recovering as quickly. Very little recovery on the number side. What's happening? Why are we seeing so many people still in the active column?
What I would do is just take a reflection on when we first started out with this and see how long it took us to recover individuals at the beginning of our first wave as well. I know at the end of the wave, people were used to every day those numbers just ticking up and getting more and more recoveries, but that's because we had slowed transmission and each of those people were now so far out from their initial case that we were able to get them to recovery. What you're seeing now is, remember, this is less than a month old, right? Our second wave didn't start until July 8th. So the people, the few people who were infected or we saw as cases and tested positive at that time, we are still getting through those individuals, getting them through their acute illness, and then getting them out far enough from having symptoms to then get to recovery. So within the next few days, you start to see that people who are now a month out are starting to recover, and then they will start adding to that column. Those numbers will then be at the same rate. They'll grow quickly because we've had so many cases. So as you got through those first few weeks, you see a lot of people got infected. Well, when it comes to them getting out to about a month out, you'll start to see a huge number of them being recovered through the Ministry of Health. And so you'll see the same thing happen on the back end.
I want to talk now about the hospitalization rate. Given the numbers, I mean, we've heard that, we're reaching capacity in many instances, but I want if you could explain the ratio of the hospitalizations for us this time versus the first wave, as well as the death ratio as well.
So our hospitalization rate is actually lower this time than it was before. If you look again back at those numbers, there were times where we had 10, 11 persons hospitalized at one time when our total number of cases was 104, right? So out of that, even if you just consider that in any one time, that was 10 out of 100 people. Now, of course, some people came in, some people left. So it's not the same 10 people, but we're just saying in general. Now you have close to, let's say, 20 people who are hospitalized, but you're at 600 active cases. It's actually a fairly small percentage when you consider it. Unfortunately, in the Bahamas, 20 more people being actively hospitalized for COVID-19 takes up a lot of bed space within our facilities, especially when it comes to acute hospitalization and ICU beds. When Grand Bahama and its issues with the Rand Memorial Hospital and not really having the hospital structure itself available and having to use multiple medical facilities to be able to take care of patients, that's a big strain on the Grand Bahama population. Here in New Providence, same thing. We have a little bit more capacity only because we have brought in a public-private partnership with Doctors Hospital to be able to use Doctors Hospital West. We've made some modifications to South Beach Health Center, so we have an additional number of beds there. So we've increased our capacity, but even if you just consider diagnosed patients is one thing, but you also have persons under investigation for COVID-19 who have symptoms and you're just waiting their lab results. Those people are hospitalized as well. So it's still a huge burden. COVID-19 is a huge burden on what has chronically been an overburdened health system. So it only exacerbates our issues. And if we don't arrest the number of infections that continues to grow, we again are going to be looking at life and death decisions where you're trying to figure out, do I hospitalize this patient or I just send them home in a very ill state because I just don't have a bed to put them on, and none of us there.
We pray we never get to that space. We're just about out of time, but I've got to ask you, when we look around the Caribbean, some of our regional brothers and sisters seem to be doing a lot better than we are. Are we communicating with those folks to see what they're doing that's worked that we can use in our context?
We absolutely are. I think we have links through CARICOM, links through the Commonwealth, links through the OAS, the Caribbean, Public Health Agency. Like, we collaborate all the time. And so I think, there are lessons that they've learned from, our approach. We've learned lessons from theirs. And I think we all will take that into account for our next waves. And people who saw us open, open early, have now decided to delay their openings as well, and to have the testing before people come in. People always talk about like the Jamaicas and the Barbados and the like. They ran into issues as well when they were saying, well, you don't have to test before you get here, but we'll allow you to test when you arrive. And then they had numbers of people who tested positive upon arrival, and then they had to figure out, what do I do with those individuals? And so they too were wishing they had mandated the issue of testing before arrival. So we all learn from each other, and I think we'll all be better for it in the end.
Dr. Brennen, thank you very much. I think it's very clear from what you're saying that there really is no blueprint that works for anyone, and it's a steep learning curve, and we're all continuously in that curve. Thank you very much for spending this time with us today and talking. Keep up the great work. Continue to keep safe. And please encourage the folks at the Ministry of Health and within the healthcare system that we do recognize, appreciate, and acknowledge the hard work that they are doing. Thank you so very much, sir.
Thank you, sir. Definitely appreciate it.
When On the Record returns, we speak with a foremost authority on infectious diseases. Stay with us. Hello and welcome to On the Record, and a balanced, true and open debate you've been looking for. Welcome back. You're watching On the Record. Tonight we discuss COVID-19, the global fight. I'm your host, Jerome Sawyer, and this segment is brought to you by the Grand Bahama Power Company. Despite copious efforts made by governments around the world, it seems as though COVID just will not be beaten. With still no vaccine or cure in sight in the immediate future, countries have been taking the advice of scientists and medical experts, putting strict measures in place. My guest for this segment of the show is the Professor of Preventative Medicine for the Department of Health and Policy and Professor of Medicine within the Division of Infectious Diseases at Vanderbilt University of Medicine in Nashville, Tennessee. With over 56 years of experience in infectious diseases, I'm happy to welcome tonight Dr. William Schaffner. Dr. Schaffner, welcome to On the Record. It's certainly an honor to have you with us tonight.
Oh, it's a great pleasure to be with you, Jerome.
Next time, we're going to make sure that you're able to come to the Bahamas to do this interview when this is all over. Many countries will be into what they're calling their second surge of COVID-19. Have we been able to identify for most countries the reasons for this second surge, as it's being called?
Well, certainly in the United States, it's really quite clear, Jerome. You know, we opened up after we had locked down. We opened up rather rapidly. And even more importantly, we opened up in a more carefree rather than in a careful way. And so people have not been wearing their masks, social distancing, and avoiding large groups. As in the Bahamas, we here in Nashville are a tourist center. And if you go downtown where the tourists like to gather here in Nashville, you will see many, many people not wearing masks, despite the fact that we now have a mask order in our community. So, this more, shall we say, cavalier attitude with people gathering together unmasked closely, even outdoors, but also indoors, has led to the spread of this virus. It's gone from our cities now into our small towns and also into our rural areas. And so it continues to spread over most of the United States.
I just want to give some context to what we're facing in the Bahamas. COVID was first introduced into the Bahamas on March 15th. That was our very first case. We had some 104 confirmed cases. However, between July 4th and August 4th, our number skyrocketed to 715, an increase of 612. But we've noticed that the hospitalization and even the mortality rate compared to the first wave is lower. My question is this a different strain we're looking at? And just to put it in context, we had closed our borders, reopened them on July 1st. Many Bahamians would have traveled to the U.S., came back home, and seemingly reintroduced the virus back into the community. Is this another strain we're looking at when you're looking at the rate of hospitalizations and the mortality rate?
It's a very important question. And so far, we think this virus is very, very stable. So we don't see major mutations. But one of the things that's happened is in this second wave, two things, actually. The first is that younger people are more affected as this virus starts to spread, and they get less seriously ill. And then the other is equally important. We're better at understanding how this virus makes us sick, so we're better able to treat those people who really get ill. So those two in combination have led to a lower fatality rate, fortunately.
And that's good news if there's any in all of this. As a country, we continue to grapple with how to safely operate businesses, schools, public transportation, even our healthcare facilities. People almost became wary during the first wave and went back to regular behavior, if I can call it that, soon after the reopening. How do we avoid that from happening again once we get past this particular wave?
Well, Jerome, I have to tell you, in all honesty, we haven't solved that issue because people are COVID tired or COVID weary here in the United States. I think our population was not sufficiently educated that once we opened up, we still had to maintain social distancing. People wanted to go back to the old normal as opposed to the new normal. Now, in my own medical center, for example, you cannot enter the building or even the premises without getting a temperature check. We get one of those automatic temperature checks, and we must all be masked. Everyone has to be masked all of the time. So we're really imposing that on everyone, but we don't want people to acquire COVID on our premises. And generally in our community, now that we have a mayor's order to do that, we get pretty good compliance, except, as I say, for all of those tourists downtown.
One of the continued arguments that seems to be happening is that the scientists and the medical experts are, in some cases, and should be, or are directing governments on what decisions to make. But there's been some pushback. And I guess it has to do with how do we get a country to function when, your economy is on the brink, people are out of work, all of these restrictions are in place, but you have the medical folks who are advising government on what to do and how to move forward. Should that continue to happen, and why is that important?
I think the countries that have done best, Jerome, are those where the politicians have the political leaders have listened very carefully to their medical leaders and have opened the country very carefully in the context of social distancing and mask wearing. That's been very, very effective. In our country, there's dissonance. The medical leaders have been saying one thing, and sometimes even in the same news conference, our political leaders have been saying something else. So it's understandable that the population is confused. When they work together, you have sustained, clear communication. The people know what to expect and why they're being asked to do these things. And if they are together, we, the politicians, the political leadership, and the medical people, you have a much greater chance for success.
We have gone through lockdowns, restricted movements. In many cases, we are back to square one with many of these actions. But have we changed or have we addressed or arrested the fundamental spread of the virus? Have we really gotten to the core of what's causing this massive spread, and have we addressed it properly?
Well, we all know that this is a very contagious virus. It's spread easily from person to person, particularly indoors when people are close to each other within 6 feet for prolonged periods of time. And prolonged, I mean just more than 10 minutes. There are some countries where they have convinced the populace that wearing masks, staying away from people farther than 6 feet, and not going to large group events, whether they are political, religious, entertainment, whatever, not attending those large group events can create an environment where people can open schools and where businesses can begin to function in a new normal fashion. It won't be the same as in prior years. And we're going to have to do this until we hope we get a vaccine that we can then distribute to the population. And that will help us. And I keep saying, I hope we have a vaccine that will get us back to something more normal.
Well, we'll come back to that question on the vaccine because I've got a couple of questions to that. But in the Bahamas, as with in many other countries, we have situations where we have intergenerational homes where there are grandparents, children, grandchildren, even great-grandchildren. And how do you address a situation like that when you're telling people that they need to quarantine, they need to self-isolate, they need to do these kinds of things when you're an intergenerational home? How do you begin to even address those issues?
Yeah, those are very challenging things. I think if everyone in the home knows that the older persons are the most fragile, because if they get sick, they will likely have more severe disease. And then in all of the interactions, if the rest of the family is careful what they're doing outside, it is less likely that this virus will be introduced into that home. I must tell you, just recently, there have been discussions here in the United States where there are such intergenerational families living together, whether even within the home, people should be wearing masks. That's how serious some medical leaders are considering this virus and its continuing spread.
Has the incubation period changed for any of this? The reason I'm asking is because, our numbers started to spike again in early July, and each day we see the numbers increasing, but we do not see the number of recoveries increasing. I asked one of our experts this in an earlier segment, but has that incubation period changed at all, or is it just the same? Because a lot of Bahamians are asking, we see the numbers rising, but we don't see people recovering.
Well, people recovering, I think generally across our country, people are doing somewhat better. The fatality rate is indeed diminishing because, as I said, we now have some medicines that can help treat people, help them get out of the intensive care unit, and may actually improve their survival. This drug remdesivir, dexamethasone, and some places are using convalescent plasma, although we're not so sure whether that works or not. We hope it does. And so I would think that even in the Bahamas, you will see people moving out of intensive care units and more of them getting home again.
Remdesivir and the other drugs that you mentioned, they seem to be working. Is that what you're telling us in moving people out of the critical stages in ICU?
That's correct. Remdesivir, the data would indicate that it makes it more likely that people will actually leave the intensive care unit. The studies weren't large enough to actually convince us that survival is improved, but the data were moving in that direction. So all of us who are using that drug to treat patients anticipate that when larger studies come in, it'll show that remdesivir actually improves survival.
Dr. Schaffner, we're going to ask that you hang around with us just a few more moments. We're going to take a quick break in our program and come right back. Don't go anywhere, folks. Our conversation on COVID-19, the global fight, continues right after this. Hello and welcome to On the Record, and a balanced, true and open debate you've been looking for. Welcome back to On the Record. This is our final segment in the show. I'm your host, Jerome Sawyer. I'm joined via Skype by Dr. William Schaffner, Professor of Preventative Medicine for the Department of Health Policy and Professor of Medicine within the Division of Infectious Diseases at Vanderbilt University of Medicine in Nashville, Tennessee. Dr. Schaffner, thank you for staying with us. What is the status of the various clinical trials for a vaccine taking place around the world, and are we any closer to finding that vaccine as we speak?
Well, Jerome, it's a bit of good news in the midst of a lot of kind of grim news. That's because any number of vaccines are now entering the final phase of evaluation, the large clinical trials. And we would anticipate those trials, which will determine how effective the vaccine is, if it is, and how safe it is. And that's also very important. They are likely going to be completed by the end of the year, or more likely, I think, the first quarter of next year. So things are moving ahead on many fronts very carefully. We're not cutting any corners, but everybody is working literally sometimes day and night to move volunteers into this program. And we have many volunteers here in the United States wishing to participate in these clinical trials. That's very heartening.
Very much so. Now, people are already skeptical about vaccines in general, given the concerns they have, even now for decades-old vaccines that have been around, for a very long time, that have helped to stem the tide of some diseases that have been with us for a very, very long time. How do you address that growing anti-vaccine culture?
Well, we try to do it in a reasonable fashion by presenting the actual information, the data, and particularly the issues regarding the safety of these vaccines. Of course, in the profession and among the public, there's going to be at least curiosity, interest, and maybe some skepticism about a brand new vaccine or vaccines that come out in the midst of a pandemic. And so the data have to be there and have to communicate exactly what the data mean. Of course, we know that in the early trials, there'll be some soreness that's already been shown and some redness and pain on injection. So some of these vaccines, as I like to say, look as though they might be some ouchie vaccines. But if people are prepared, they will understand this.
Now, once a vaccine is developed, how long traditionally does it take for something like that to get to smaller third world, even underdeveloped countries, because we're looking at a situation, we've got, 350,000 people, we're a small country, still a developing nation. We're looking at where do we fall in the line to get a vaccine like that once it's been proven to work and it's been put on the market.
And you're exactly right. It's always taken a lot of time for vaccines to filter out throughout the world. But this is a global pandemic. Everybody has that front of mind. The World Health Organization is looking at that quickly. I wish I could tell you exactly how this vaccine, if there is one, will be distributed globally, but there will be a lot of attention devoted to that it doesn't just go to the developed countries of the world, that we provide this benefit to the world's population.
The debate over hydroxychloroquine and whether it is safe or an effective treatment has gotten louder. Why are medical experts continuing to discourage the use of this as a form of treatment?
The use of hydroxychloroquine has been, in a sense, politicized. On the medical side and the public health side, there are now good data to indicate that although hydroxychloroquine was a good idea at the beginning, once it was tested and evaluated in very rigorous trials, it was shown not to be beneficial in either preventing or treating COVID infections. And so the medical community really, almost 100%, is not using this mode of treatment anymore. And we've moved on to, as we were talking about before, remdesivir, the steroid dexamethasone, and in some instances, convalescent plasma.
Currently, to enter the Bahamas now, you need to quarantine for 14 days upon arrival if you come from another country. Some of our potential visitors have called this excessive. Is this a wise preventative measure?
It's a preventive measure that is being used in many parts of the world, including within the United States. So such quarantine really minimizes the introduction of new infections into your country. It's a very solid public health intervention.
Are those PCR gold standard tests still the best way to go to find the positives?
At the moment, the PCR tests are the gold standard, but testing is changing as science introduces new tests. And we are having antigen tests that are quicker, that are starting to come into use here in the United States.
The Bahamas and a lot of other Caribbean countries, particularly in the first wave, were thought to have done really well in their response and management of the crisis. Looking from where you sit, looking at what's happening in countries like this. Do you think that's a fair assessment? Do you think we would have done well? And what are some of the things that you think may have worked for us?
Well, I think early identification, Jerome, of cases was important. Contact tracing, finding those individuals, quarantining them, using testing to identify the extent of the infection was very important. Now we can't let down our guard, right? We must maintain social distancing, mask wearing, and the like, and continue that contact tracing so that we can bend that curve back down again.
From very early on, we were warned of a second surge. I think it was even predicted to be later in the year or even next year, but we're in that second surge almost. Can we prepare ourselves, or should we prepare ourselves for another surge if and when we get past this current crisis?
Well, first, second, some people say this is just an extension of the first.
That's another question as well. Is this still an extension of the first?
Yeah, I think most of us think that. The second surge we were concerned about has to do with that time of the year when we see more influenza in addition to COVID. So we would think that influenza would start up, at least in our part of the world, usually in about November. It starts to be active. And we thought that COVID would also become, if you can imagine, even more active at that time. And that's what we were concerned about, that second surge. And speaking of influenza, we all ought to try to get vaccinated against influenza this year. That's at least something we can do something about. The vaccine's not perfect, the influenza vaccine, but it really does mitigate the impact of influenza. And we can use all the help we can get this coming season.
That's an important note, too. I think a lot of times we overlook or we may be skeptical about getting that influenza shot, but you would advise to go ahead and, particularly this season, to get it.
Absolutely. We are really promoting it. We've started that already here in the United States. We won't start vaccinating until September and October, but we're already trying to educate our population that this year, definitely roll up your sleeve for that flu shot.
Good to know. What are some of the long-term health consequences of a COVID positive? I mean, what are we looking at in terms of long-term effects versus the acute effects?
Those studies have now begun, and it's clear that after you recover from the acute illness, some people don't get back to normal functioning immediately, and they can feel fatigued. They don't have fever. They don't have acute infection anymore, but they feel fatigued. They have achy joints. Sometimes even their thinking can be a little bit confused, and that can last for weeks. The other thing we're trying to follow up on is those people who had really severe pneumonia, and once they are recovered and back home, have they lost some of their lung function? Are they now somewhat compromised? Is there scarring in the lungs? Those studies are currently underway.
Any idea on when we may be able to get some definitive findings?
I think we'll need to follow a fairly large number of people for at least 6 months to a year. So I think next year, those data will start coming out.
What are the expected effects on young people? And looking at it in the context that a lot more young people are now becoming infected.
Yeah, Jerome, you're asking all the hard questions. No, we're writing this textbook as we go along. This is nothing we can look up because it's a new virus. So what is the impact on young people? From the beginning, in every country, it was clear that young people were markedly less affected than older people in terms of severity of illness. The question is, do they get infected and don't get sick? And can they transmit the virus? If you had asked me this question 2 months ago, I would have said, I don't think they get infected and we don't think they can transmit. We're having to change our mind about that. We don't have definitive answers, but there are clearly circumstances where children have become infected and they can transmit the virus.
Okay, my final question really goes back to the heart of all of this. This virus began in China. That was the epicenter. What has China done really, seeming that's caused them to be able to move forward and be in the clear? I would have seen just a report last night where people are returning to work. Things are seemingly getting back to normal. What would they have done to get them to this point of the recovery?
Let's recognize that they have a different political and cultural system than we do. They locked down the city of Wuhan and the surrounding communities absolutely completely. As I said at the time, that was the largest public health experiment done in the history of humankind. And you know, it worked. It really interrupted the transmission of that virus. But you couldn't leave your house if you were so locked down. And they kept it locked down for a long time and then opened up very gradually and carefully. That's what they were able to do, and they have managed to keep the number of new cases very, very low.
Interesting study. Dr. Schaffner, we are at the end of the program. I just want to thank you for taking the time and talking to us today. You've given us some great, insightful, helpful information. Thank you very much. And thank you for the great work that you're doing. That's certainly benefiting all of us, even in the Bahamas, but certainly I'm sure other countries in the world as well. Thank you so very much.
It's been a great pleasure. Thank you for having me.
Okay, thanks a lot. Well, that's going to do it for tonight's episode of On the Record, COVID-19, the global fight. A special thanks to both of my guests, Dr. Delon Brennen and Dr. William Schaffner. Special thanks to my production and technical teams for making this show possible. And of course to you, our viewers. Remember to stay up to date with the latest news and information on this network, on Our News Nightly and Our News Bahamas Facebook. We'll see you next time, same place, same time, right here